My name's Robert Sterry. I live locally in Woodford. I've been coming here first of all with varicose veins, and then it sort of developed as my health worsened. I had prostate cancer and bladder cancer and various other treatments. The last time I was here was 2 years ago approximately. I was rushed to Whipps Cross and was there for approximately a week. And my consultant got involved and he came to see me in Whipps, and they didn't have an operating theatre available, so he rushed me back to Holly and operated on me here and looked after me very well. Saved my life, basically. I have recommended the Holly in the past, and with my two sons have both been here to the GP clinic. Very good at making the patients feel at home. It's a warm, friendly place to be. It's clean, it's hospitable. Usually it's very cosy and warm. So I think making patients feel as though they're being cared for well. In general, the hospital have encouraged feedback, and that's why I've been asked to attend the meetings, which I do. And I'm glad to say that some of the feedback that I've given has been obviously used. There was a particular treatment room which was quite new in the new wing, and I was there each Saturday morning receiving treatment, and it was always cold. And I asked for blankets, and there weren't blankets available. That has now been changed, and there are blankets available in that. So that has been responded to. Another comment I made about when you leave the premises, it's very difficult because you've got to cross the pavement. It's often difficult to see around the corners, and lights have been put there so that when you are leaving at night, you can be seen, or you can see other people crossing. On the patient forum, we generally talk about all things to do with the hospital. We've actually had a walk around the hospital looking at different departments. We've talked about health and safety, we've talked about cleanliness, etc., etc. Every time I come to Holly, it's friendly, it's cosy, it's a pleasant atmosphere to be in.
My name's Mary Pirrie, and my connection with Holly is a patient with several different consultants. So I've seen quite a lot of the hospital over the years, which is probably over 40 years. So I knew Holly when it was a house. Obviously, as years have progressed, Holly's become bigger, more modern, and my experience has been really very good. I've met lots of different people within Holly, the nursing staff, the admin staff, and I've always felt that I was welcome here. There's a nice atmosphere, and what I came for has been dealt with in a nice way. It's a group of people that have been past patients. We all sort of have got different ways of expressing ourselves within the forum. The director is at that meeting, and there usually is about 10 or 12 people there, all various types of people, so there's a good spread. We discuss certain items. There is an agenda that we follow, which is good because it can go off in different directions if that doesn't happen. It's there to help the patient and the hospital. What we did discuss in the meetings was the signage, and that has been put right. And that was put right fairly quickly, which was really good, because it was difficult as you come in the doors because you sort of see one reception area, but most people go to outpatients. And that long walk up, which again they did look at and addressed it, where they've got now like a concierge type chap, and he takes the people up in wheelchairs. But yeah, I mean, I think every area you've looked at, and it's when the new MRI area was opened, it was something that was quite exciting. We were given all the information with regard to that, as we are with most things within the hospital. When the new menus were discussed, we were invited to sample some of those, which were excellent. The food was delicious. And I believe it's still that way because I've asked several people and they do say, yeah, it's lovely. Anybody that I know that's younger that has got private medical insurance, I will tell them, get to Holly. I do think that you try to do everything that is possible to make the patient feel welcome and comfortable.